Hey everyone, Nikki here with the Truck Boss Show. Today we're joined again by a good friend, Dr. Dixon. She is a certified medical examiner, chiropractor, and a registered dietitian with the Drivers Health Clinic right there in Wildwood, Florida. Thanks for joining us again, Dr. Dixon.
Thanks so much for having me. This is great.
Of, of course. Last time we talked about drug testing. And I want to switch it up this time and talk about a popular subject, which is sleep apnea. For some of our audience that might not know what sleep apnea is, can you kind of fill them in on what it is and maybe how it is related to the trucking industry?
Sure. Sleep apnea is something that's hugely important if you have it. So basically, what happens is you lay down to go to sleep and your throat starts to actually close. So you can't get air through. It's not your throat, it's more your trachea, but there's pressure down. So that airway is being blocked. Now, that's a huge problem because then you can't get air. So your body stimulates itself to wake back up. And then you go through the cycle and over and over and over. Some people do this so long that they're actually losing hours of sleep throughout the night. And this is creating a huge problem.
So then how specifically is this affecting the truck drivers?
Well, when you don't have ample sleep throughout the night, it affects you. And then our drivers aren't getting the sleep that they need. There was a study showing that with severe sleep apnea, there were up to 15 minutes throughout the day where your drivers, or within an hour, that your drivers are literally nodding off. So you can't have a driver going down the road nodding off. They may not even realize it. It's a micro sleep, so they're driving all of a sudden and then they may wake back up. Hopefully, right? You don't want to drive down the road and just go to sleep. So this is a big problem in the industry because if we've got drivers out there that aren't getting sleep because they physically can't sleep at night, then we need to fix that.
What would you recommend the remedy for this?
Well, they have a great machine out there, CPAP machine, BiPAP machine, depending on what you need. But what it does is continuous pressure through. So it holds that area open so that you are now able to sleep. It's done wonders for so many of my drivers. And I know the drivers out there hate to hear the dreaded, oh, you have to go have a sleep test. But if you need it, you truly need it. It affects so many organs. It affects your heart. It affects blood pressure. It can, lead to diabetes, cause weight gain. So many things happen at night during that sleeping process that people aren't aware of. And so those things aren't happening when you're constantly waking yourself up. You're not able to get into REM either, which is that deep sleep when you're constantly waking yourself up. So that CPAP machine goes on their face with a continuous pressure and allows them to sleep, and it works amazing.
Where can they find this specific product? Do they have to go see their physician, or where can they go? Can they just go online and order it?
A lot of drivers find it from the DOT physical. Okay, so they come in, we tell them you need to go for a sleep study, or they go to their physician and their physician says they need a sleep study, and so they send them off. There's two ways to do it. That used to only be in-house. You had to go sleep in this place. They put all this stuff on your head. Now they have in-home sleep tests. So you can put a cannula on your nose. There's a strap around your chest, and then a pulse oximeter goes on your finger, and you sleep like that all night long. Okay, you take it, you put it back in the box, and you mail it off, and within 48 72 hours you've got the results right there. They're incredibly reliable, so, and they're much cheaper, so you can go with those options, and there's great companies out there that you can count on to give you great results.
Nice. So, was there ever an actual law regarding sleep apnea, and what are the requirements?
So in 2014, when FMCSA put all of the laws together to make us certified to do this exam, they also put recommendations. They did update those recommendations in 2016. It's doctor discretion, and they have a few things that go with that. But there was a point in 2017 where they were talking about passing a law just based on BMI and your neck size. That law was pulled. It was never voted on. It was just pulled. Do I think it'll go back up at some point? I do. But at this point, that law is not in effect. It did go back to, or never changed from, doctor discretion. Unfortunately for the drivers, doctor's discretion varies by doctor, right? So as a baseline, we still do measure necks and we still do BMI, because as you're overweight, your neck size is increased and there's a lot of fat on there, right? So you're obese and you've got this weight sitting here, and as you go to sleep, it actually pushes down on that trachea, causing that obstruction. Now, other things cause that obstruction: adenoids, tonsils, an enlarged tongue, oversized uvula. But those all can be corrected surgically. When it's just too much weight here, either weight loss or CPAP, those are really your only options. So to get back to the law, is there something hard and fast that says A, B, and C, you need a sleep study? No, but there are